Joint movements. Osteokinematics. Osteokinematics is the movement of bones around a synovial joint's axis. Synovial joints. Joins bones with a fluid-filled space called a synovial cavity, filled with synovial fluids. 6 examples of synovial joints are pivot joints, which would be your C1 and your C2 vertebrae, hinge joints, like an elbow or a knee, saddle joints, which would be between the trapezius carpal bones and first metacarpal bones, ball and socket joints, like your hip, condyle joints, like between your radius and your carpal bones, and then plane joints, like your tarsals. Flexion. Bending movement of one bone on another bone, bringing 2 segments closer together, and a decrease in joint angle. Examples of this would be chin to anterior chest, anterior forearm to the anterior arm, or the anterior thigh to the anterior trunk. The knee is the exception to the rule because it is the posterior side moving the posterior leg towards the posterior thigh. Palmar flexion. Palm to the forearm. Plantar flexion. Pointed toe. Dorsiflexion. Fingers towards your posterior forearm, toes flexed upward toward the knee or shin. In dorsiflexion, the dorsum goes to the superior anterior part of the extremity. Extension. Extension is the straightening of a joint. Extension of a flex to remove the angle from a joint. Returns the body to the anatomical position. Hyperextension. Continuation of the extension beyond anatomical position. Your shoulders, hips, wrists, neck, and trunk can all hyperextend. Abduction. Movement away from the midline of the body. To take away. Adduction. Movement toward the midline of the body. To add to. Rotation. Movement of a limb or part around its long axis. Medial rotation. Anterior surface rolls inward toward the midline. Medial rotation is also known as internal rotation. Lateral rotation. Anterior surface rolls outward away from the midline. Lateral rotation is also known as external rotation. Medial and lateral rotation are specific to the shoulders and the hips. Supination. Turning the palm up or forward anteriorly. Imagine holding your hand in a bowl shape and filling it with soup. Pronation. Turning the palm down or back posteriorly. Imagine pouring your bowl of soup out of your hand. Inversion. Moving the plantar of the foot inward at the ankle. Eversion. Moving the plantar of the foot outward at the ankle. Protraction. Moving away from the posterior midline. An example would be pushing your jaw forward. Shoulder girdle, moving the scapula away from the midline of your back. Or an arm parallel to the ground, moving forward away from your core. Retraction. Moving toward the posterior midline back to anatomical position. An example of retraction would be setting your jaw back in line. Your shoulder girdle moving the scapula toward the posterior midline of your back. Your arm parallel to the ground, moving backward to your core.